This week's video, I had an awesome opportunity to talk to a massage therapist in Tampa. Her name was Maggie, and she's been struggling with a client of hers, really trying to figure out the root cause of what's going on, if they have a neck, shoulder, or a combination of both those problems. So we got on a Zoom call and really went through all the history points and really be able to figure out exactly what's going on. And I wanted to share that with all of you this week. Everybody, Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. I said in the intro, I really like doing these, and if you're ever interested in one, send me a message. I like to help educate and help educate others about getting to a tissue-specific problem, asking the right type of questions. So went and did this Zoom a few days ago and wanted to share it with everyone, like going through really asking the right type of questions, patient communication, how to educate them properly, and really just putting it all together. So much treatment ends up being kind of like a shotgun approach, trying a bunch of stuff and not really knowing what's working or what's actually helping the problem. So in this video, we really broke down getting to that tissue-specific diagnosis, knowing exactly what to do and how to communicate effectively with the client that they need this type of treatment, and you're going to be able to help and actually do it in a shorter treatment time. So I'm going to link that video up right away.
All right, so I got Maggie here in Tampa. Tell me a little bit about yourself.
So I'm a relatively new therapist, massage therapist. I recently graduated end of September last year, but I've always been an athlete. I've competed in bodybuilding shows. I rode horses growing up. So I love working with athletes, and I call them the lifestyle athletes. They're in the gym, they're active, doing classes, whatever. That's kind of my niche right now. But yeah, that's kind of the main topics.
What made you want to, how long you been following me?
I don't honestly know. It's been a couple months now for sure.
Okay. And then what made you want to reach out? I know we kind of talked back and forth. I think you really liked the article I wrote about the pain pill epidemic and why massage therapists are key, right? That's where we started kind of talking a little bit more.
Yeah, I definitely have seen that you're obviously very intelligent and know your stuff. And I think that article really hit it home of I've always felt like I am such an asset, but massage therapists aren't really seen as a huge asset anymore. I think it's gotten better now that a lot of chiropractors are bringing in people, obviously they can charge for massage under their insurance and things like that. So it's becoming more accepted and utilized. But I've been to chiropractors before where they don't do any type of soft tissue work, and I felt like it just wasn't enough. And I even have people tell me that. So I definitely think that seeing that really helped me be I agree, and I'm glad that somebody else, a very established professional, sees that as well.
I pretend to be established. I'm still figuring it all out sometimes. But so what we're going to do today, and what I'll do for people that are going to watch this on YouTube, I'm going to link up a video. I always point in the wrong. I think it's either on the right or left. I'm going to link it up. It's a webinar that I did, going through the 12 must-ask questions before that, because a lot of problems that I see with massage therapists is they want to just kind of jump into treatment, and they don't really know what's going on. And that's my whole idea of working smarter, not harder. My favorite people that always make me laugh are the ones who are well, I'm just an intuitive healer. I just can, get in there and just know what's going on. I'm like, that's such bullshit. Get the hell out of here with that stuff. So Maggie reached out because she has a specific client that's kind of getting stuck, not really sure where to go. So I'm going to take her through all the questions and then kind of give you a better idea, if what you can do, or possibly if they need a referral, or kind of what's going on. So first off, you said it's going to be a male. How old are they?
He just turned 30.
30. And where do they feel most of the pain?
It's the right shoulder neck area. More specifically, he said that he feels a lot in the upper trap, supraspinatus kind of area, levator. Okay. But he gets, the typical knots underneath the shoulder blade type feel. Right next to the spine, rhomboid mid-trap area as well.
Do they ever get any pain in the lateral part of the shoulder?
Not that I'm aware of, but he did have surgery on there. I think he said he tore the labrum, and he's torn the labrum in the other side. He just didn't do surgery because he was well, the surgery obviously Did not
Didn't
help
work.
on the right side. Yeah. So he's like, I'm
How
just
would
not.
he describe the pain? Sharp, dull, aching, throbbing, stabbing, numb, tingling, burning?
It is mostly a stabbing pain. Let me find his answer more specifically. Mostly stabbing in the pains. He also gets it up at the top, like suboccipital. Mostly stabbing in all the pain, the spots that I mentioned. He does get the occasional tingling and burning in the arm and shoulder when it gets super flared up.
When he does get it in the arm and shoulder, like how far down does it go? Does it go like the whole way down, or does he get it more like above the elbow? Like,
honestly, he did not say.
yeah, that's a big thing that I'm always looking for, especially if I'm trying to figure out, do I got a neck or shoulder problem or a combination of that? I really like to pinpoint. I'll dive in a little bit deeper on like symptom location. I'll send you over when we get off here. I'll send you over the shoulder webinar where I go into like trying to figure out if I have like a ulnar nerve, median nerve, or like a radial nerve as well, because symptom location gives me an idea too. So you're already giving me good data, but even more, just because I'm trying to think. It sounds like he's got both problems, like a shoulder and a neck, but I'm like, I'm always trying to figure out like what's my primary, gives me a better idea. So on pain level, and I always like to kind of, give it a scale, 0, no pain, 10, you wouldn't care if I cut it off. Like, what's his worst pain?
So he said that when it's just like, it's always like a 3 to 5. But when it's super flared up, he said it's like a 9 to 10.
And how often is he getting like a 9 to 10?
So he says that, it ggets worse throughout the day. So like wake up, obviously it's 3 to 5, and then it just progressively gets worse. He said it doesn't, that happens whether he exercises or not. And then what else? So probably pretty often. This has been going on for a minute.
Okay. What can really flare it up? Like what type of movement?
So he does a lot of running. He's very much like a cardio intensive. So I'm assuming just the swinging back and forth of arms when you're running naturally.
Okay. How about when he does get like a 9 out of 10? Is there anything you can do to make it feel just a little bit better, give it some relief?
Says the only thing that has worked in the past, years that he's had this is heat and then just massage in general.
Okay. Now you said so was it the right shoulder that is bothering him now, right?
Yes, that's when he's also had surgery.
That's the one he had surgery on?
Yeah.
And then he had an issue on the left as well, like.
Yep, just no surgery on.
Just no, so he has confirmed labral tears on both. Okay. Who else has he seen besides you?
He said that he's seen a sports ortho guy, spine ortho, and he's had 2 MRIs done, one for cervical spine and then one on the complete shoulder.
Okay.
Both have shown nothing, because that was one of my questions too. I was thinking of like bone spurs, anything like that. Says he's shown nothing. He's seen physical therapists, other massage therapists besides me, and chiropractor.
Did the neck show anything?
He said no.
And this is where he's going to be into some trouble, because he's only 30. And this is where I like to live in like the middle of the road. So what happens is they look at him at 30, and what they're looking for is like the big, bad, scary stuff. They're like, oh, does he have cancer? Is there a bone problem? They don't look at the middle of stuff. So a lot of times they'll downplay things like some bulges or even like possible herniation, be like, you're fine because you're only 30. And then you get this, there's this whole like facet of like musculoskeletal practitioners out there. You always see it. They're like, you're not your MRI. Like your MRI doesn't matter. Like they've done studies where they've seen people have disc bulges and they have no pain or whatever. But what these practitioners forget is the client's coming to you because they have pain. So that MRI does matter to me. So we can't just like downplay it. They're not just like, oh, I feel fine, I'm coming in. They're motivated to come in because they have a problem. No one wants to just go because like, oh, I want to just go. They're going because they have a problem. So that structure does matter. And let's see, what is he like? What's a normal like activity load for him workout wise?
He's pretty active. I'd say 5 to 6 times a week. He's done like the Spartan races, definitely that type of intensity and exercise as well.
What's he do for work?
Nothing super active. I wouldn't say it's like 100% a desk job, but not, you know, blue collar.
Not blue collar stuff like that. Okay.
Yeah.
What do you think's wrong?
My kind of first thought was, because obviously we've worked on the muscular, tendon, ligament, all that fun stuff side. And while some stuff has like helped dramatically, like working on scalenes last time, I know that he said that that was like a huge improvement.
Yeah.
A lot of times we hit scalenes, traps, levator. I'll hit the internal rotators. And while those help, it obviously comes back later.
Nothing's really lasting.
Yeah. My first thought was like just a nerve entrapment, or, you know, things still being torn or just not healed properly. And I thought that it was very interesting that it was the shoulder that we've had surgery on and not the one that we didn't have surgery on. He also did say the last time I saw him that he's had 2 injections into that shoulder, and he said that the first one was horrible. He said he didn't know if it was like they did it wrong, it was just in the wrong place, whatever, but it was like he was out for like a couple days, like just move it. And then the second one, he said that it was a little bit more lateral, and that one helped a lot more, and that one actually felt better and helped. But other than that,
yeah, the problem for injections are they're garbage, because they don't. I was just listening to a podcast the other day. He's a guy named Peter Attia, and he's like a medical doctor, but he talks about like longevity. And he says the problem for like injections and stem cells and all that shit is it doesn't require you to do any work, and you have to do the work. So they're like, oh, I can just get this injection, but what it does is actually causes, you might temporarily feel better, but it's actually causing more damage there. It'd be like your check engine light came on, and you said, fuck it, pulled the switch, and then kept flooring it, and you wonder why things blow up because the surgeons want you to blow up. So here's what I'm thinking. I'm thinking this manifested as a shoulder problem. And usually when I'm working a shoulder case, I'm going to be working both shoulders. A lot of times the symptomatic side is just the one doing the extra work. It's kind of like a group project. You got one shoulder kind of slacking off, which is going to be his left shoulder, and the right's doing all the extra work. So a lot of times what I end up finding is it's like drilling a cavity. When you're doing the treatment, you want to get all of it. And then what happens is we kind of jump around. So we get some of it in the shoulder, and then we jump to the neck, we get some of it, but then it comes back from there. And what you need to do is really focus on getting one thing off the plate at a time. And what I'd say for him is probably going to be shoulder first. So think of his labrum is like his thumb stuck inside a car door. The car door is all that scar tissue that surrounds there. So you can't give this a chance to heal up till you remove it. And where I tend to find most of dysfunction in there, not as much in the internal rotators, more in the external rotators, because they have to lengthen more. So a lot of like scar tissue involvement specifically, and I'm going to record this for you too, so you'll have it so you can go back. A lot of involvement, especially in infraspinatus. It's such an important muscle and just like shoulder mobility and stability. And then it puts a lot of pressure on the joint capsule itself. That develops a lot. Then I start to see some issues in the subscap, and then eventually I'll go in and clean up some work in the lat, like especially on the attachment there. And the goal first is really to get the shoulders moving better. I do a shoulder functional test where I basically look at shoulder abduction first, because I really don't give a shit about internal or external rotation until we have this global motion first. Cleaning up all those structures and allowing that, then building up some of the strength in the shoulder, very basic stuff that I do, like side lying, overhead press, lockouts and things like that. Then once the shoulder's in place, then I start to attack the neck. And what's happening in the neck is now we've got some damage to the disc, specifically to the joint and the disc, because when the shoulder can't move how it's supposed to, trap, levator, all that stuff lends a hand to help with that stability. And its real job is actually to support the neck. So now it's doing two jobs, and then the neck gets trashed. So the reason he was feeling better when you work the scalenes is because you basically got a little bit of that out of there. It's like you freed the thumb from the door a little bit, and it's like, oh, it feels a little bit better, but then it jammed right in there. So what's happening is you're addressing the shoulder, but not fully. Then the neck continues to kick on. So you're just chasing each thing, and you're never really getting each one out of there. So it's like picking one thing at a time and then processing that as you go, and then it makes it better. And usually what I end up doing, if I'm trying to decipher between neck or shoulder or a combination of both, I usually start with the shoulder first because they're bigger, easier structures to get, and it takes the pressure off of there. And the key is really going to be symptom location on that one. So if I have someone that comes in and they're like, hey, it hurts back here all the time and only here, I'm like, that's a neck problem. That's neck all day. But when he's getting some here, he gets a little bit down the arm, and he's got the history of the shoulder problem, I'm going to go after shoulder first. And usually you can clean those structures up pretty quick, then go in and clean the neck up.
Okay.
I talked a lot. So thoughts?
No, I definitely agree. I also just was looking back at like our actual notes. So what I was reading from earlier was when I asked him those questions, but I was looking at my notes from like our different sessions and stuff. And I do remember that we have worked on, I think it was the same appointment that I did the scaling work with, was when I hit more of like posterior delt and then to infraspinatus, like pretty hard. And obviously like I do a lot of movement in my sessions anyways. So that was like the same one. So I remember him specifically saying like that it was very, I don't want to say painful, but like tender, when people are like, ooh.
Like it hurts, but good. Like you're doing something there. And I think what actually happened is you in your mind at first you thought it was a scaling, but you actually cleaned that shoulder up pretty good, and they took the pressure off of here from what you see. Yeah,
that makes sense.
And that's what you're just seeing in there as well. How many treatments have you done on him?
I've seen him for, let's see, since the beginning of like pretty much the beginning of this year, but we've also worked on like knees, hips, pretty much full pain. But this is always like the just lingering thing.
Yeah, and that's a big thing, is like I teach a lot in my trainings about like communication and really putting out one fire at a time. That's like I talk about like the idea of like working smarter, not harder. And that's like having a conversation with the client, because treatment's like a medication. You can do enough to be effective, but I think everyone overtreats and they do too much. So they're like, they don't realize there's like diminished gain. So what I'm looking for in a treatment with me is I'm spending 15 to 20 minutes with that person, but I'm looking for like a 5 to 8% improvement per visit. So I'm getting that treatment right. I always look at it like a pain medication. I can give you enough to make a difference, but I can overtreat you from that. So that's what I call like the kitchen sink approach. We're just doing a lot of stuff. And then his focus is all over the place too. He's like, oh, well, then he's thinking about his knees and all that. So that's where you would just go in and have a conversation and be like, hey, I had a talk with someone that's an expert in this kind of stuff, and it really helped. And what I realized is like, we really need to focus on this one problem at a time because we want to get it off your plate. And I'd rather have you see him more often, but less. So what we always start people off with is like twice a week for like 3 to 4 weeks. That allows me some time to get the dosage right and not overtreat it, because you're not going to get someone 50, 60% better in one visit. You can think you can, but I don't know anything like that. And it just allows you a more systematized approach as you go, and really kind of having that plan. Because I wrote an email a couple weeks ago, like sometimes you just feel like you're winging it. You're like, I don't know what really works. Like I did this or I did this. Like you're going to know each time, because you're like, shit, I only worked infra, capsule, subscap this visit, and he noted he was 20% better. So I'm going to keep doing that instead of being like, I always say, learn to do less, just better. That's where so many people are. They want to do so many things in a session. They want to stretch it, cup it, move it, do all this stuff. And I'm like, the more variables you add, the more you don't know what's working. So it's like really focusing there. And that would just be having a conversation with them. I definitely don't think he needs a referral, because they're just going to shoot him full of drugs and want to do surgery on that.
Yeah.
But really explaining a little bit better about what's going on. I had some good stuff. I'll send it over to you when we get off here. I have a whole educational series on YouTube where I talk about like labrum issues, rotator cuff issues, and things like that. And that's what's really just lacking is there's like a disconnect with clients. Like you're doing well with them, but they still disconnect. They still put you below the surgeon, below that, because that's just what people do. And it's just like your whole identity. Like I talk to people all the time. I'm like, don't say you're just a massage therapist. Like I teach people when they first come in my program, I'm a soft tissue specialist. I fix this problem. This is what I do. And I always say, people don't give a shit about what you do or how you do it. They just care that you can do it. And that's what you're seeing is like, you're doing too much of like a shotgun approach. I want you to be more like a sniper, like going in there and opening that up. So thoughts?
No, I definitely agree. And I definitely appreciate that for sure.
Yeah. It's just like, it's my main goal really with all of this is just slowing down and asking questions and trying to do not so much treatment, but the right treatment, and people always say to me, they're like, oh, you're full of shit. Like you can't get results in 15 minutes. And I'm like, I can, because I actually do a consult like this before, and then we do a thorough exam. So we earn that right as we go. And that's where I talk about like selling to the result for the client. We have them pay for all their treatments up front too, because we want them to be committed to that, and that's what happens is you hold yourself to this, you get too stuck on the symptoms instead of like the objective data of how it's going. Like I know that the only way I'm going to get you to feel better is if I can get you to function better. And that they're moving better, but each thing is just like piling up there. So it's like, take one block out at a time and then go from there.
Yeah. Cool.
Yeah. Yeah. That's a good one. Do you have any other questions for me?
Not that I can think of right now. That was the main one. I felt like I was just like, I felt like I was on the right track, but I just hit a roadblock, and me and him both, we're just like, we don't know what to do at this point. So I definitely, which, also a personal friend of mine. So I'm like, I need
that's hard. That's hard because you got that relationship there, but at the same time, they trust you and they know that. So you can be like, hey, we were doing good work before, but I didn't really have a plan. Like, here's what we need to do. Because like the biggest take homes there are like, get away from doing the full body stuff. Like I get it where people are like, well, if the ankle's bad and then the hip's out of line and it does all that. I'm like, yeah, I get that. But what you got to do is start regional and then work global. So I eventually do like more stuff, but I start there and then spread out as we go. And most people like spread out and try to go, and then you never really know what's working. So big thing there is just communication, doing less treatment, just more effective, and seeing them more often too, as opposed to just like once a week or once every couple of weeks. I'm like, I'd rather get you those shorter bursts because then we can have healing in between. Did you go through the free training?
I don't think so.
Yeah, go through that. I show I show the shoulder test and all the palpation. Okay. I'll send you a link. You can sign up for that, and we go through a lot of this in the free training, and I go through infra treatment. That's been the biggest thing that I've seen for shoulder. There's also neck and low back and hip and all that kind of stuff too, and some of the communication modules.
Okay, yeah, that'd be awesome.
Yeah. Any other questions? Any other feedback or insights or?
Nope.
Yeah, you're doing good. I mean, you're early in the profession, so you're new, so you don't have a ton of bad habits yet, but you're also realizing that you're not the shit yet, and that's what happens. Sometimes I get people fresh out of school and they're like, I'm great. And other people are like, so like you're being at least humble to know that you can be better and help more people. So
you made it through to the end. Thanks for watching. I hope you got a lot of good information out of there. If you liked the video, give it a comment, a like, a share. Go grab our free training. We really dive into these 12 questions, the 7 problems to figure out, and help you get in the idea of thinking more clinically and being a clinician first, then a technician second. So much treatment is you just jump in and see what happens, and you never really know what's going on, and you get stuck in what I call winging it. I want you to be clinical and figure out the problems in the first place. Appreciate you guys watching, and I'll see you on the next one. Bye.